Facial rejuvenation is a huge part of my practice. Skincare and soft tissue quality are such a big part of the outcome you get from facial rejuvenation that I wrote an entire book about the topic. And we'll talk about that here at the end of the show. One of the things that I hear a lot from patients who come in from the outside, when we start talking about skincare, we start talking about facial skin quality, is that lasers don't work. And I have to scratch my head. And after talking to a patient, I figured out why. And today we're going to talk about why that is and how to keep that from happening to you. Welcome to the Trillium Show, where each week we talk about ways to improve your mind, your body, and your life. I'm your host, board-certified plastic surgeon, director of Trillium Plastic Surgery and Trillium Aesthetics, Dr. Jason Hall, and soon-to-be published author. Lasers are a great treatment option for skin rejuvenation, but not all lasers are created equally. You have to choose the right treatment for the right problem, but then you have to use the laser correctly to get the outcome that you're looking for. In today's show, we're going to kind of break down the three things that are absolute musts to get a good result from a laser treatment and talk about how to go about getting the best result for you, if that's something that you're interested in. Now, lasers are a hot commodity in the world of aesthetics. They're a hot commodity primarily because they're good marketing. Now, they work really well, don't get me wrong, but for a lot of non-surgical aesthetic practices, lasers are a great marketing tool. It makes a practice seem like high tech with it to offer a laser, and they use these lasers as magnets to draw new patients into their practice and try and differentiate themselves from the other practices around. You have to understand a little bit about the economics of non-surgical aesthetic offices. Lasers are fantastically expensive pieces of equipment. A cheap laser costs about $70,000 to $80,000 for one box with a laser in it. If you start talking about kind of top of the line, best in class laser devices, kind of note not to brag, we have one of those. You start looking at price tags for these machines that are $200, $250, $300 plus $1,000 for a single device. You can imagine that for a business to spend that kind of money, whether they just write a check or whether they finance it through their bank or and take out a loan, you need to pay that off. That's a huge amount of money. You need to pay that off. And so there's a lot of financial pressure for these practices to try and use that device as much as they possibly can to pay off their investment and then start recouping that investment and making money. That is where you, the patient or prospective patient, can get stuck, because whether people know it or not, and I don't think any of this is malicious, it's just human nature, the laser gets sold as kind of that late night infomercial. It slices, it dices, it chops, it cuts. A device that can do everything. And while lasers are very versatile, they can't do everything. And they don't do everything. Even the best ones don't do everything. So that's just a little background. Keep that in your mind as we're talking about lasers today. So we said we're going to talk about the three things that you needed to make a laser treatment worth it. Those three things are: one, a correct diagnosis; number two, your treatment provider, doctor, injector, laser tech, has to choose the right treatment for the problem that you have; and then the third thing, and it seems like a given, they have to use it right. And if those three things aren't fulfilled, then your chances of getting a good laser treatment that you look back and go, wow, that was really worth the money I spent and the downtime I had, is pretty slim. So let's talk about each one of those. So first is diagnosis. Now, having a diagnosis, a working diagnosis, is one of those things that is drilled into us from the very beginning of medical school. You can't select a treatment without having a diagnosis. If you've got chest pain, you don't go to the doctor and get a triple bypass for your chest pain. You want to diagnose the problem first. So is it a blocked artery? Is it indigestion? Is it reflux disease? Is it some other kind of weird, you pull a muscle? You don't want to throw a treatment at a problem without having a diagnosis first. In aesthetics, a lot of that has gotten lost with the internet and with social media. You know, you hear about a treatment, somebody looks great. What'd you get done? Oh, I had X, Y, and Z. Okay, I'm going to go get that same thing because that's what I want to look as good as you do. And they go into the office, they say, well, do you have X, Y, and Z? Well, yeah, we do. Here, it's on sale. Here you go. And you don't get the result that your friend did because you started from different places. And so it's really important in aesthetics that we remember the basics, that we start with a diagnosis. What's the problem? A lot of the patients that I see coming in from somewhere else who have had treatments that they're not happy with say, what were you looking to treat? And they say, well, I wanted to look better. Okay, well, that's everybody wants to look better. Why? And so we have to dig deeper and figure out the reason that they feel like they don't look good as they could, and then design a treatment plan around those things. Is it lines and wrinkles? Is it brown spots? Is it redness? Is it little blood vessels? Because each one of those things can be treated with laser, but needs a different treatment modality, a different laser to treat it. And so getting a diagnosis and having a very firm diagnosis is really the first part of getting a great treatment. The second part is choosing the right laser, choosing the right tool to treat the problem that you've identified. Lasers are great at all of those things we mentioned: reds, browns, lines. Pore size is another one. Can do all of those things. Most lasers does do one of them really well, may do two of them, but certainly won't do three or more at the same time. And so we have to kind of prioritize and pick the right laser for the type of problem that we're treating. In my office, we have a platform called the Cyton Jewel, and it's got treatment modalities for each one of those things. And we'll kind of run through those just so you know kind of what they are and how we go about talking about treatments. So the first and probably the least aggressive is BBL, or broadband light. It's a not laser light treatment that is really excellent for pigment. So think brown and red. Does a great job with those. It is a non-ablative treatment, very little downtime, but really targets those reds and browns. A step up from that is something called the Halo. Now, the Halo is unique because it's actually two lasers in one. It's a non-ablative laser plus an ablative laser. And so it's good for mild pigment, not as good as the BBL. It's good for pore size reduction, and it's good for overall skin texture. Now, this is a great laser. We'll talk about how we use these here in a minute, but it's a great laser if you have mild, early aging changes. A step up from the Halo is the ProFractional, and that is a fractional ablative laser that is kind of the king at pore size reduction, overall improvement in skin texture. So people who get ProFractional treatments, their skin is nice and soft and buttery, is the kind of the workhorse for acne scarring, surgical scarring, things like that. Much more powerful than the Halo, but then also doesn't do the pigment things that the Halo can do. Lastly, we have the TRL, or tunable resurfacing laser, and this is a full field ablative laser that is great for lines and wrinkles and is good for some pigment. And the neat thing about this is that we can vary the tunable portion of that. We can vary the depth, so we can be really light and just do a treatment almost with a topical cooling, or we can go so aggressive that we have to be in the operating room or close to operating room to get make sure that you're comfortable enough to be able to tolerate the treatment. So it can be very, very aggressive. Great results, but very aggressive. And so all of those things, all of those four modalities treat something a little bit different. They're all lasers except for BBL. But if we're choosing one that really isn't suited for the other, we're using a TRL and we're looking for pigment, we're not going to get the results that we wanted. So it's important that we choose the right laser for the problem that we diagnosed in step one. The third part of that is then using the laser that we choose correctly. And this is another mistake that I see and that I've made myself early on in my experience, is that we try and hurry up laser treatments. In general, laser treatments need to be done in a series. You know, if we're talking about, say, BBL, we're looking at pigment, browns and reds, 3 to 5 treatments is kind of average for how many treatments it's going to take to get to our best result. Same thing with halo. It's typically sold in packages of 2, spaced about 4 to 6 weeks apart to get that good result. Profractional, depending on what we're treating, depending on how significant acne scarring is, how bad the pores are, how large the pores are, and how kind of rough that skin texture is, can take 2 or 3 treatments. With scars, acne scars especially, it can take 3, 4, 5 treatments before we really get our best result. TRL is a different beast in that the most aggressive setting where we get our best results is typically a one-shot deal. Now, we are pushing your skin to the absolute limits, but at the same time, it's typically a single treatment to get that best result. But you have to use the laser correctly. You have to have the energy set right. You have to treat enough times, and you have to do the peri procedure, so that, you know, skincare before and after, to really get that best result. I've thrown a lot of terminology here about lasers, non-ablative, ablative, fractional, full field, and you can check out this video here. I kind of broke down all of that in a separate video, so it's not completely foreign to you. But suffice it to say that lasers are a true workhorse in my practice. They are absolutely awesome at improving the skin quality, improving the skin texture, improving the pigment and the color. And when we're doing facial rejuvenation, that is a huge deal. So before you go and plunk out a ton of money on laser treatments and take time off and all of this, make sure you do your homework. Make sure that those 3 key points are being fulfilled before you embark on a laser treatment journey. You want to make sure you're getting the biggest bang for your buck when you have a laser treatment. We don't want you being one of those people who go, lasers didn't work. So for the past 8 months, I have been working on a book about skincare, about the kind of tricks that the aesthetic industry likes to play to try and get you to spend your hard-earned money, and about the products that work, that are backed by science, the products that don't work, that are not worth spending your money on. And I've outlined all of that in the book, as well as a science-backed treatment plan that includes all of these different modalities, lasers and fillers and RF and skincare, so that gives you a good template when you're looking to get into the aesthetic world of what works, what doesn't, and what not to waste your money on. So it should be available on February the 1st. I've got a link down below. You can buy it on Amazon. We're going to have hard copies in the office. You can buy hard copy paperback ebooks on Amazon. But check that out. Let me know what you think. As always, thanks for watching, and we'll see you soon.